Good morning everyone. Our topic is thalassemia screening and prevention. Thalassemia is an inherited blood disorder which is characterized by the reduced globin production which is due to defective globin chains alpha or beta. This leads to anemia and severe health complications. It is caused by various molecular defects such as gene deletion or substitution, premature gene termination, and we can see the normal RBC, but in RBC in thalassemia the size and the color is reduced. These are alpha and the beta chain of hemoglobin.
There are mainly two types of thalassemias, alpha thalassemia and beta thalassemia. Alpha thalassemia occurs due to less synthesis or total absence of alpha globin gene, which occurs usually due to the deletion or mutation of alpha globin genes. There are 4 copies of the alpha globin gene, and based on the number of alpha globin genes present, there are 4 types of alpha thalassemias. First one is silent carrier, in which there are 3 alpha globin genes present. Second one is trait, in which there are only 2 alpha globin genes present. Third one is hemoglobin H disease, in which only 1 alpha globin gene is present. And fourth one is hydrops fetalis, in which there is absence of all alpha globin genes. Second is beta thalassemia, which occurs due to the mutation in beta globin genes. It is of mainly 3 types, which is based on the number of beta globin genes present. First one is minor or trait. In this, there is heterozygous condition in which one gene of the beta globin is affected, and second one is intermediate. Third is major beta thalassemia, also known as Cooley's anemia. In this type, both the genes of the beta thalassemia are affected.
Clinically, it represents chronic anemia, in which there is a severe decrease in blood RBC count, and patient becomes tired even during a small physical task, and normal skin color becomes pale. We can see splenomegaly, in which there is an enlarged spleen size, and bone becomes unequal in shape and size, and also there is an increased risk of heart failure and many other congenital heart diseases.
In the high-risk individuals, the thalassemia is highly recommended. Screening is recommended for the people who have the family history of the thalassemia. Mainly the individuals who have the microcytic hypochromic anemia, and especially when the cause is unknown, they are highly recommended for the screening test. Then it is high prevalence population group, example Mediterranean regions, the Southeast Asia, Indian subcontinents, and these areas have the high probability of thalassemia screening test. Then premarital couples are highly recommended for this test as they might be the both carriers of this disease. So the children having thalassemia major is high.
I will discuss the initial screening test for beta thalassemia. The first test is the complete blood count. Common findings include decreased MCV, which stands for mean corpuscular volume, and mean corpuscular hemoglobin, indicating small and less hemoglobin-rich red blood cells. The RBC count is usually normal or increased. The second screening method is the peripheral blood screening. It typically shows microcytosis and hyperchromy. Characteristic features such as target cells, basophilic stiffening. The third test is NESROC, which stands for Naked Eye Single Tube Red Cell Cosmetic Fragility Test. It is simple, low-cost screening test and is positive in most thalassemia carriers. These screening tests help identify individuals who may carry beta thalassemia and guide further confirmatory testing.
Various confirmatory investigations that can be done to screen thalassemia. Some of them are hemoglobin electrophoresis. It is a specialized blood test that uses electricity to detect, detect and measure different types of hemoglobin. Like the normal value of HbA2 is from 1.5% to 3.5%, and it increases in thalassemia. And the normal value of fetal hemoglobin, which is HbF, is 0% to 1%, and it can be variable in thalassemia. Next, we have high performance liquid chromatography. It is a test that is used to detect and quantify different types of hemoglobin. So quantification of HbA2, HbF, and other variants of hemoglobin is done. DNA analysis can also be done to detect mutation, find out about carriers, and Prenatal diagnosis is also done through DNA analysis by screening the mother.
Carrier detection helps to identify whether the individual is carrier or thalassemic. If one partner is carrier, then we should go for check for the other partner whether she is carrier or not. If both partner is carrier, then professionals should go for counseling and explain them what are the chances that thalassemia pass to their offspring and what are the medical diagnoses that they can have to have healthy offspring like prenatal diagnosis and other reproductive options. And carrier detection is simple but a powerful strategies to prevent thalassemia.
Prevention is better than cure. Since thalassemia is a hereditary disorder, preventing its transmission is the best way to reduce its burden. The first way is premarital screening. Couples, especially in high-risk population, are tested before marriage to identify whether they are carriers of thalassemia gene. Second is genetic counseling. If one or both partners are carriers, genetic counseling is provided, which helps couples to learn about the inheritary pattern. Third is antenatal screening. During pregnancy, antenatal screening is performed in high risk women using tests such as CBC and hemoglobin analysis. Fourth is prenatal diagnosis. When both parents are carriers, prenatal diagnosis is recommended for them. Techniques such as CVS as in chronic villus sampling and immunosynthesis. Fifth is public awareness programs. Finally, public awareness programs play a vital role. Education campaign, community screening, and voluntary testing increases awareness and encourage early detections, helping reduce the burden of thalassemia in the society.
This we come to the end of our presentation on thalassemia. We have learned about its causes, types, symptoms, screening methods and preventing strategies. We hope this presentation has enhanced your knowledge about thalassemia. Thank you.